Welcome to another episode of Weight Loss with Dr. A.
Hey guys, how's it going? Dr. Alvarez here, and welcome to our episode of Weight Loss with Dr. A. I'm Dr. Guillermo Alvarez, and I am part of the Endobariatric group at Endobariatric.com. And well, the idea of these longer videos is we can attack these subjects, these topics with a little bit more ease, more depth than regular questions of the Ask Dr. A show or more superficial answers as we normally do online. So the idea of the show is to go in deep at any given subject, and today I wanted to talk to you about using weight loss surgery in general as a tool. Yes, we can talk a little bit about the types of weight loss surgery, but it's not intended to on this episode to go in deep with all the differences in all the types of procedures out there. We can leave that for another episode though. But in general, weight loss surgery as a tool, most patients that I see don't understand that weight loss surgery is a tool only. Yes, it is a very powerful tool, then when you use it correctly and when you put in a lot of effort and you are completely on board on this procedure and you are committed, the results here are absolutely amazing, outstanding, very, very, very good. On the contrary, there are patients that in a bad way think weight loss surgery is a miracle, that weight loss surgery, just because they decided to move on forward and take the step and get weight loss surgery, that all their troubles will go away. It is not that way, does not work that way, and well, you, the patient, need to understand this, because the more you understand this concept, the more you work with this procedure, the better outcome you will get. Obesity nowadays is a very complex disease. Now the World Health Organization has defined obesity as a clear disease. Now, this disease is very common, as you already know. Obesity is an epidemic around the world, and mainly here in America. So the United States, Mexico, Canada, it is a very, very severe problem we have. You know, 7 out of 10 patients, population, 7 out of 10 are obese. Not morbidly obese, which is another category, but obese, which is very frightening numbers here. So you need to be aware. Nowadays, I mean, sometimes it just, it's saddening. It's very sad to see that you go to a mall, you go to an amusement park, and we are getting used to seeing people obese. Shouldn't be that way. Now, obesity by itself is a problem, but sometimes, and very commonly, it goes hand by hand with other problems, other comorbidities like high blood pressure, like diabetes, like metabolic syndrome, like sleep apnea, and I can go on and on and on. These problems go hand by hand with obesity, and once we remove obesity, once we tackle obesity, once obesity gets better, most of these conditions go away. It's not a rule, but most cases it does. Now, there are many ways you can lose weight, and we know this, and everybody knows that you can diet, you can exercise, you can diet and exercise. There are other options like medical treatment, like pills and other medications that suppress hunger and appetite, but these have not shown to be well, sustainable results down the road. That is where weight loss surgery comes in, and it is a very good option for patients that have failed with other treatments or are morbidly obese and are looking for a way out to win the battle with toward obesity. Weight loss surgery is a well, let me start by saying that weight loss surgery is designed, number one, to have better quality of life and for you to live longer. Please understand this. Understand that weight loss surgery exists, and it exists because we want to make the patient's lives better. We don't want to make them shorter. We don't want to cause harm. We don't want to make it unsafe. We want to be, us doctors, us bariatric surgeons, for you to make your life better, to make your life more complete, to make your life make you live longer in better shape. That is the idea. That is the objective of weight loss surgery. The reason I'm telling you this is because sometimes I do get it in my office that a patient comes in with mom and or husband and or dad and or aunt, and you know, and somebody has an opinion saying, well, I think you shouldn't get weight loss surgery because that is some dangerous stuff. People die there. Well, people die crossing the street. People die driving their car. People die flying airplanes. You know, I mean, we are always at risk doing something. The thing is having a percentage of safety. So weight loss surgery has a complication mortality, let's say mortality rate less than 1%, which is really good. And normally now, under other general surgery procedures. Why is it safer now? Because, well, practice does make perfect. Time has taught us quite a bit. Now with the laparoscopic era, we have learned a lot. Now that practically all the procedures that we do are done laparoscopic, which is minimally invasive surgery, patients recover quicker. Patients develop less complications like upper airway, pneumonia, wound problems, because there's no big incision, there's no big wound. And since there's no big wound, well, patients have less pain and they recover quicker, and then they can get up to the restroom and move around faster as well. So all these things we've learned throughout the years to make it nowadays a very, very safe, very, very effective procedure that is designed to give you two things. Take-home message is designed to give you quality of life and make you live longer. That is our goal. That is your surgeon's goal, for you to live longer, have better quality of life. So the other thing is important for you to understand is if you're looking into weight loss surgery, or if you qualify for weight loss surgery, is that sometimes it's far more riskier to stay with the current weight you have than having surgery by itself. So I tell patients, having surgery in a controlled atmosphere. What is a controlled atmosphere? It's like flying on a commercial airplane from Washington, D.C. to New York City. I mean, if you're flying through, let's say, a commercial through American Airlines. You fly out from Washington, D.C., heading out to New York City. Is it safe? Is it safe to fly? Yes, it is. What are the chances of you getting to New York City? Well, fairly high. You probably will get there. Is it dangerous? Is it dangerous? Well, yeah. I mean, you're at 30,000 feet in the air, so there is a risk involved. That is the same type of risk involved in weight loss surgery where you go in a controlled atmosphere, all right, controlled atmosphere, which is the operating room. Now here, there are a lot of variables involved, talking about, how much experience does your weight loss surgeon have, how many procedures have they done, how many hours of flight, in other words, all right? So these persons flying the commercial jet, the captain, the captain's assistant, everybody has a role there. And how many hours of flight has this team have? So it's very important because that involves more safety. So the idea and the message here is you're going into surgery. It is a controlled atmosphere. The risk involved in surgery by itself is that much. The risk involved of not having surgery and being morbidly obese is way, way above that. So if you stay being morbidly obese, you are going to cut your life short. It is a matter of time. It is a ticking bomb. So what you want to do is lose the weight somehow, some way, for you to have a better quality of life and live longer. That is just in short words, the idea of having weight loss surgery. Now, let's talk about types of weight loss surgery. Types of weight loss surgery, we divide them in two ways. We divide types of weight loss surgery in restrictive procedures and malabsorption procedures. Restrictive procedures, the lap band and the gastric sleeve. Malabsorption procedures, we're talking about procedures that involve rerouting intestines, talking mainly about the gastric bypass and duodenal switch. Now, it's not this today's topic. We can have another discussion talking about the differences on these, but these procedures are proven now by major associations around the world, talking about the International Federation of Surgery for Obesity, which is the IFSO, the World Federation, and the ASMBS, which is the American Society as well. So these procedures are approved by these associations. These procedures are the authorized procedures for weight loss for patients that are looking into weight loss or weight loss surgery. These procedures are done around the world by bariatric surgeons, weight loss surgeons, and we define, it's important for you to understand, we define a successful weight loss procedure or weight loss surgery when a patient loses 50% of hers excess body weight in the first 12 months. That is what we define as that was a successful surgery, okay? So that is a successful surgery. And the reason I bring it up is because sometimes it's very sad for me sometimes to see it on boards online, to see it on Facebook groups where a patient has lost quite a bit with the weight loss procedure and regains it all back, or if not all, well, most back. I'll give you an example. I lost 100 pounds and now I have these 100 pounds again on me. Was the surgery successful? Well, yeah. I mean, it took off the vast majority of the excess weight. What caused the patient to regain this weight? Well, I can almost assure you the procedure was not looked at as a tool by the patient. It's very important the patient sees this procedure as not a miracle procedure, merely as an ally. He or she will have an ally for life that you need to work with it. Believe me, people, when I say dealing with obesity, this is a daily struggle for everybody, all right? Our bodies are designed to store energy. That is it. We are designed to store fat. That is it. Why? Because that's the way we're designed to be since we were cavemen. All right, we are designed to store energy, and we store it as fat. So it needs to be seen as a constant, daily struggle. Maybe just get the word struggle off that sentence and daily focus. Constant, daily focus. And you need to work around this procedure to get the most out of it. If you don't, will the procedure work for you? Will the procedure make you lose weight? Yes, most certainly it will make you lose the weight. But if you're not focused, and even though you're able to eat just very small amounts of food and you decide to stack in there junk food and bad choices of food, sooner or later you'll lose weight, but sooner or later you may have weight regain. And if you don't switch those bad habits, it'll start crawling up. Okay, so it is very important, and the message of this session is for you to understand that is the tool. Weight loss surgery is a tool. It's very strong, very powerful tool that you can get the most out of. Now, that is why we exist. That is why we have psychologists on board. That is why we have nutritionists on board, dietitians on board, and this is a multidisciplinary group for you. And it's very important you understand. It's also very sad that patients sometimes consider the procedure as a miracle. They get the procedure, they cross it off the bucket list, and they think all their problems have been solved. It isn't so. You need to know what you're getting into. This is a lifetime commitment. You need to be committed to this procedure and be completely on board for you to get the most out of it. Now, if you stick to the plan, if you stick to the guidelines, if you stick to my patients, my books, and you will be able to get the most out of it and get the most out of this tool without falling off the wagon. We are always here for you, us, the medical community, your doctor. We are here for you to always guide you on this journey for better health, for weight loss, for a better you. So always remember that the patient will always have to put in the effort. The patient will always have to put in the work, because I can't do it for you. I mean, once you leave the facilities, once you leave the glass doors, nobody, not even your family member, your spouse, your parents, will be on top of you noticing what you put in your mouth or what you don't. So you need to be convinced that weight loss surgery is effective, weight loss surgery works, and weight loss surgery needs to be seen as a tool. Can you refocus down the road? You fell off the wagon. Can you get on? Yes, you can. Why? Because the procedure is in you. The procedure is always in you. It's done. You could always retake control and get the most out of it. Remember, it is a daily struggle. Work with it.
If you're interested in knowing more about the gastric sleeve, visit endobariatric.com.